So we found out when she was 2 days old, while we were still at Johnson Willis, and the consulting cardiologist on duty came and talked to us and let us know that she had pulmonary valve stenosis. The pediatric cardiologist and the neonatologist that was at Johnson Willis consulted about some of the medications that she was placed on to keep one of her valves open to compensate for her defect, and they weren't comfortable with her being on that, so we were transferred to Children's Hospital.
Bristol has a heart condition called critical pulmonary valve stenosis. One of her heart valves doesn't open freely. In fact, it was formed almost nearly closed. It's a life-threatening condition if not treated immediately. Transporting a child with a cardiac condition has risks in itself, so just transporting in itself carries some risk. And then in addition to that, I think that families find comfort in knowing that there's local care that's capable and committed to providing and taking care of its own community.
Being able to have this procedure so close to home helped us so much because we have a 5-year-old. We didn't have to leave her. We have family that's close by, but it was just great being able to have everything so close to us, to not have to travel.
It was important for the family to understand that we had a team here that was experienced and capable of providing treatment for the heart condition, and that we were available for them for as long as they needed us. The procedure that Bristol had is cardiac catheterization. This is done with the heart beating without need of open heart surgery. We put a little tube called a catheter in her leg, and we put a balloon across that valve that doesn't open, and the ballooning allows that valve to open.
She went from having 93% stenosis to, I think it ended up being like 7% at the end. So very, very positive reaction to the procedure.
I think all the providers understand that having a sick child or a child with a heart problem is probably one of the most stressful things that a family experiences. I think, our role is to mend or take care or manage the medical problem, but a lot of the times we provide as much care and comfort to these larger and bigger hearts. I really look at every team member as being a leader of the heart program. My job is really to facilitate the team to be able to do that.
So Dr. Lee just told us that we are released to 1-year visits with Bristol for her follow-ups. She literally was our angel. She had this calming air about her when she walked in the room. Just had the best confidence in her, knowing that she was taking care of Bristol.